Now we are live. When you're ready, we'll start. Okay. All right, hello everyone. This is Kim Inspire and the Arise team. I have Sarah Perk here and Charles Leffingwell if you have any questions as we go. I'm going to just spend a few minutes today walking through the Pediatric Asthma for EMTs and MAs. So feel free to jump in if you have any questions as we go. For MAs, we have some new features that we want to show you today. One is a asthma severity protocol that they can use for this 16-year-old that's coming into the clinic and to help them assess how bad their symptoms are. We've incorporated asthma action plans and various patient education handouts. These are all open source materials, so you are free to use them as part of the teaching plan, as well as part of the Arise project with the AIR staff. Another really exciting thing is incorporated are some videos of the patient performing different skills, like peak flow meters, using alveolar nebulizers and things like that, so the students can actually evaluate if the patient's performing it correctly, and then provide some education based on that. And then you can re-scan the QR code and see if the instruction was worthwhile or not, or whether you needed to do some more education. So that's kind of a big feature that we've incorporated in the asthma scenarios. You'll see them also in the nursing and the respiratory therapy scenarios that will be coming out in the next month. For EMT, we're really excited. One of our new features is hotspot. We've incorporated that in with lung sound. So if you're not in a sim lab, if you still want to use these scenarios in a more of a lab situation, or students can even do this at home, I'll show you where they can press on different hotspots on the screen and then hear different lung sounds according to the anatomic location. We've also incorporated protocols for EMRs, EMTs, advanced EMTs, paramedics, and those are based on the Chippewa Valley protocols that CDTC developed along with the Eau Claire area EMS. And again, those are also open source, so can be used with students to think through their response to patients. And like I said earlier, they can do this independently or in simulation or a lab. So let's start with MA Level 1. Our Level 1s are always just basic collection of data. This is Patrick. He's 16 years old and he comes into the clinic. He has known asthma, and this is just a follow-up visit, so he's very stable. Students are going to look at the asthma action plan, document vitals using our vitals tab. There's a growth chart that we'll see here on the next slide, and then do some coaching, like I mentioned, with the asthma action plan and patient handout. So I'm not actually going to walk through this scenario today, but we're just going to point out some of the key features. So here's an example of that growth chart that I mentioned, and this is under one of the tabs on the iPad. So the students can look at that while they're gathering their data and actually plot the patient's height and weight using this form. This is an example of the asthma action plan. We have them just kind of handwritten out, like the student would see them as completed by the provider. And then they can refer to this while they're caring for the patient. If they're getting a peak flow, then they can look at these numbers and determine where he falls within the range, if he's in the green, yellow, or red zone, and then decide from there if the provider needs to be immediately alerted or calling 911 or things like that. Level 2 has all the same components, but in addition to collecting that routine visit data, this is where they're actually going to get a peak flow reading. And so we're going to click here on this hyperlink, and you can see the video that they might see. So there's 3 different videos we have of Patrick. 2 of them are performing the peak flow incorrectly, and one is the correct way to do it. And the facilitator is in charge of that by instructing the student which QR code to scan after they give their education. So it's really guided by the facilitator in terms of, do you want them to see the correct video or the incorrect, and then go from there. Another video we have is of him using an inhaler. case, obviously, is the one of him doing it incorrectly, allowing the students to evaluate that and then provide more education. And then you could follow up with the correct use of the inhaler to show them that their instruction was effective. After those two things happen in this scenario, they're communicating with the provider, and this would be role-played by your technician or the facilitator, another student. They get new orders, and this occurs with the iPad by scanning a facilitator code, which allows you to progress through the scenario. And then at that point, a new asthma action plan will show up under the tab data and some more patient handouts based on some new medication that's ordered, which is Advair in this case. So MA level 3, now we're getting into more of kind of a change in condition or an unstable situation, generally is what's occurring in level 3s. So in this situation, he's coming to the clinic that he's having an exacerbation of his asthma. And so let's watch that video real quick so you can see what he looks like.
I was hanging out at a friend's house today, playing video games, and I noticed I was having a hard time breathing, like around lunch. But I took my inhaler, but I didn't take the gas. Like an hour later, and this cat came walking through the room. And I was like, "When did you get a cat?" And my buddy was like a month ago, "Where have you been?" And I was like, "I'm really allergic, and it's messing with my breath." And so that was kicking his butt in that end. But I finished and left. I used my inhaler at least 4 to 5 times. I called my dad at work, and he told me to go to the doctor. That's why I'm here.
You can see in that video we're trying to address a few things for the students to notice. One obviously is the symptoms that you can see him having with his labored breathing. Another is collecting data from the subjective data that he's giving them. And the third thing, getting a little feedback here, is the third thing that you can see is, the developmental considerations with a teenager and how they would change their approach to his developmental stage. So after they watch that video, and I'll show you the protocol here on the next slide, but then they would try to get a peak flow reading to gauge the severity, look at his asthma action plan, see that he's in a yellow, almost red zone, administer a nebulizer according to the protocol, and then discuss their findings with the provider. And then at that point, they get new orders again, similar to level 2, and they can use additional handouts like we have a screenshot here. And so the next one, there we go. The next slide just shows you the protocol for determining how severe his symptoms are. And again, this is open source. We have a credit on the screen where we obtained this, but it helps them to just assess their breathlessness, how he's speaking, his respiratory rate, his use of accessory muscles, and then his pulse. And then determine how bad is this exacerbation, keeping in mind if respiratory arrest is imminent or severe asthma exacerbation is happening, they're going to call 911 right away. And you can see here in this, in the protocol at the top, this is where they are permitted to give a stat duo neb treatment immediately while they're waiting, if it's a really severe situation. Okay, I'm going to stop there for a second and see if any instructors, MA instructors, or anyone has any questions specifically about the MA scenarios. Okay, I'm not hearing any, so I'm going to go forward with the EMT paramedic scenarios. There are 4 EMT scenarios, and then there's 2 additional paramedic scenarios, and that's because we're using the National Registry of Emergency Technicians psychomotor exam, and when we get up to the level 3 and 4, which is the secondary assessment and the reassessment, it's a little bit different between both groups. So again, this is our 16-year-old patient, Patrick Armstrong, but where the scenario starts is in the car. And so he was having an asthma attack. He attempted to drive himself to the hospital, but his breathing got worse. And so he pulled over and called 911. And that's where we start with level 1. So they're going to do a scene size up with the video that's provided. So you can see that's just a quick scan of the environment. Sure, you can put it in. It goes pretty fast, but it gives them a chance to see, yes, it's a car, it's in a parking lot, there's no other traffic. Questions from the facilitator would include things like, is it in park? Is it safe to approach the vehicle? Or, all those questions that the students would get through. For the next one. This is just an example, as you know, the form that is used, the actual psychomotor exam, and this is what we built all the EMT this is for all the EMT scenarios. So level 1 is the scene size up, level 2 is the primary survey, level 3 is the secondary assessment, and then level 4 is the reassessment, like I mentioned. So level 2, now they would start again, doing a scene size up, and then they should do a primary survey. So we're going to watch a video of the patient as part of the primary survey.
I started having a hard time breathing. I took my inhaler around lunch, but I had to take it an hour later. All of a sudden, this cat walks into the room, and I'm deeply allergic to cats. And I had called my dad from work. He told me to go to the ER. So I had to get into my car and start driving, but my breathing got really bad to the point where I couldn't drive anymore. So I just had to call 911.
So the story is similar to what we heard with MA, even though it's a whole different discipline. But at that point on the screen, the students would be prompted with asking some questions, like how would you assess the patient at this point in doing a primary survey. Level 3 then starts again, walking them through a scene size up primary survey and secondary assessment, and that's where the hot spot lung sounds will come into play, which I'll show you here in a second. And then, like I said, level 4 is that reassessment. And in the EMT scenario, it ends with them providing a handoff report to the arriving EMS. We did incorporate the 15-minute time limit criteria that's on that psychomotor exam. So there are timers in place within the different scenarios, so that within 10 minutes, if they have not made a transport decision and indicated on the iPad, they get a warning. And then if they don't make a decision within 15 minutes, it automatically exits them out of the scenario, just to try to mimic the real-life criteria that they're held to. So this is an example of a screenshot from the iPad. You can see the one area, maybe you can kind of highlight that box right there. So if they tap, that's not on the screen when they look at it, that box, but once they tap in that area, then the box appears and they'll hear lung sounds. And so we have 4 anatomical locations in the front and 4 in the back. And so when they tap on it, then they'll be able to hear crackles or normal lung sounds and then verbalize their assessment as they're listening to it. As I mentioned, with the paramedic levels 3 and 4, now we're using the advanced level psychomotor exam. Basically the same videos that you've seen already and the hot spots, but at this point when the reassessment occurs in the ambulance, he becomes unresponsive. So let's just take a peek at that. So the video, we tried to simulate what it's like to be in a moving ambulance with the sound, the movement, and then just his change in condition. And at that point, they would be able to refer to the protocol and verbalize how they would address the patient's condition. This again is the psychomotor exam that we're using for the paramedics. And then this is an example of the protocol. So you can see how we just pulled out the respiratory distress protocol for asthma in particular. The different colors, you can see where the EMR, the EMT, first it's in blue and then it's in green. So they have to look at this and determine what is their scope of practice. For the paramedics, then they can go down to the lighter blue there and see what they can administer. And per MCPO means that when they call in to the medical director, they would anticipate getting this medication. And so we include that in there so that they would be able to practice administering that, or at least talking through what it is, how it works, and how it would help the patient at this time. We cut off the bottom part here in the screenshot, but the next part in the paramedics is the drug-facilitated airway management, and that's actually 3 or 4 pages of protocol for them if they need to intubate the patient. At that point, they can walk through how they would do that. So that's kind of the walkthroughs of our new features for the MA and the EMTs. Like I mentioned, in the next month or so, we'll be releasing the nursing and the respiratory therapy scenarios, and we have new features in those as well. We have those videos that I showed you earlier where they're doing the peak flow and the nebulizers or the inhalers, but these scenarios will also have specific lung sounds for the different locations. So they'll have different QR codes for each anatomical location, so as the students scan those, they'll hear lung sounds. And we also are incorporating some ventilator scenarios so students can practice with that. So that's the end of our webinar here. Do you have any questions at this point?
This is Colleen from WCCC. I just had a quick question. Hi, I'm having trouble, and thank you for sending me the working QR code right now, but I'm having trouble when I scan QR codes, and I'm wondering if you're suggesting that people actually cut them up into squares so they're easier to scan?
Yeah.
Versus having them on a full page?
Exactly. I'm glad you asked that, Colleen, because in the teaching plans we have it on one sheet. But yes, what we're recommending is those boxes that are on the teaching plans, we actually cut those out. Some technicians are actually shrinking them. You can shrink them to about 1 inch by 1 inch. How does that mean? For it to still work and pick up, for the iPad to still pick it up. So yeah, definitely. And since you mentioned that when we do the different anatomical lung sounds in the future scenarios, we actually have little flaps on the QR codes, because you probably found, Tommy, how it's easy to accidentally scan one that you don't intend to scan otherwise. So.
Okay, great, thank you. And one more quick question. Is there a way to log out when a student just goes through part of the scenario, so that when they go back into the app, they don't have that picture feature to go through where they take a selfie?
Yes, and in the asthma scenario going forward, we have the exit tab available at all times. So by exiting that way, they'll get a message if they haven't reached all the learning objectives that we have plotted out. They'll get a message, are you sure you want to exit? All data will be lost. But otherwise, if you're at the end, it'll say, you give them a message that it's okay to exit. So, yeah, they can exit at any point now, so you shouldn't have to go through that process of taking your picture and putting the name in and logging out to get to the home screen to scan.
Okay, thank you very much.
Thank you. Any other questions? Is there anything, we know this one was short and sweet, but is there anything that you would want to see covered in a webinar that we could maybe swap out? We've been kind of just going through new content as it goes, or as we release it, but if there's anything specifically that you would like to see, or if you were in your lab and something wasn't make sense that we could do a screen share, We can make these more of an open forum if that's the format that would maybe be useful. Really, we have one scheduled in April, and then we haven't scheduled any beyond that, as we're kind of trying to determine what's a good next step in educating. So if you have feedback, you can either let us know during one of these webinars or email anyone on our team or Blair. All right, well, we're excited.
Kim,
go ahead. Yep.
Kim, is the MA respiratory one available now?
The MA respiratory is available now, yes.
For which one?
Okay.
For asthma.
The asthma?
PAMA?
Yeah. We have short acronyms, so I'm just double checking with Charles. We call it PAMA for short. So
There's four of them.
there's four, like, yeah, levels 1 through 4. And so the teaching plans are available on WIZ. They're on our website, theadvicepractice.com. And then the apps are out there available under the AIRS app, the scenarios are out there too.
Right. Okay.
So we do recommend everybody start these by scanning the start code on your teaching plan. The best way to get in, just because potentially they could freeze up if multiple people are going in through the game list at one time in the same area. We haven't found that to happen yet, but we do recommend scanning the scan to begin code with the teaching plan.
Okay.
Does anyone have any? All right. Does anyone have any?
That's it for me. Thank you.
Okay, thanks. Does anyone have any best practices or good experience that they've experienced in using this in classroom simulation?
I just wanted to share, this is Colleen from WCTC. We did use it, this is speaking from the nursing program, I think would apply obviously anywhere. We have a pretty robust simulation program already in place, but we did use it in the classroom for an end-of-life scenario, and the students actually brought earbuds in and used their iPads on their own, while the instructor facilitated them going through the simulation. It actually brought up a great way for them to kind of go through at their own pace and have some discussion points. So that instructor really did enjoy it, using it in the classroom as well. We have Apple TVs as well. So an instructor can actually just facilitate it completely on their own and just have the students talk through what they would do next, but just a different way of looking at how to use the app.
Awesome. That's great to hear. More for sharing. Thanks for sharing. And we're really trying, as we move forward, like with the asthma scenarios and then the next ones on next are heart failure and after that's OB, we really are trying to design these so there's minimal questions to get stuck with the QR code scanning. So that, like by using the facilitator QR code, you can, as an instructor, move them through to the next state if you'd like, and thus make it easier to use in a classroom situation. So I'm really happy to hear that some people are expanding their use into the classroom. We have gotten a lot of data that a lot of people are using it. I shared it in the biennial presentation. If you weren't a part of that, I think that's shared out on the, we can share it if you'd like. We have the overall survey data that way, if you'd like to look at it. I don't know what it's on. Is that on the secure content website? It's on the website, okay. So, all right, I'll just check one more time if there's any other questions. Okay, well, thanks for joining us today, and always keep us posted what where you're using the right scenarios and how we can improve them even more in the future. So thanks again.